Next up, we have Joanne Alfieri. Creation and pilot test of virtual cases for our learning oncologic emergency management. Thanks.
So I'd like to thank you for the opportunity to present really this work in progress. I'm going to talk about the rationale for development of these cases, the description of the tool itself, and then a small pilot result. Basically at McGill University in our MDCM program, which is our undergraduate medical program, we have, the students have little or no exposure to radiation oncology. It was actually no exposure at all until January of this year, and starting January of this year, they have a very small exposure to radiation oncology, and that'll be explained a little bit later in the talk. The 4-year program goes from a systems-based approach, and then there's a transitional to clinical practice time, and then clerkship. And really, in all of this, there's no oncology. I'm exaggerating a little bit, because in the systems, obviously, we talk about basic science of malignancy and transformation, and then in the clerkship years, they do have to know that cancer is a differential diagnosis of various presentations, but there's no formal oncology training in the medical school. In our residency, this is what it will look like as of July 1st this year. We're changing to a competency-based medical education design, but more or less, at least in the launch year, the timing will be similar. So medical students come in at the entry to residency stage, and then at least in our program, the transition to discipline will be about a month of introductory radiation oncology, outpatient and inpatient exposure. And then they'll go on to foundations of discipline, which is really medical and surgical subspecialties. And then the red arrow here is indicating what is approximately the start of PGY2 year, where those residents will be exposed to emergency management, basically as of July of their PGY2 year on an inpatient service covering the Department for Emergencies, and then starting in November on night call. And what I was hearing a lot from my meetings as program director with PGY3s was the anxiety and the stress they felt not knowing really how to manage these patients with the current format, which was our current format for teaching oncologic emergency management was an academic half day in about July or August of the PGY2 year. And so the aim of this project was to supplement the current learning, especially for junior residents. We started off with three common emergencies, so spinal cord compression, SBC syndrome, and so hemorrhage or bleeding from a tumor, which in this case was a rectal cancer. We use the Decision Sim platform. I have no involvement with the company. It's just that the Nancy Posel, whose picture is there, is a virtual patient case education expert. She actually is based at the university and started working with this platform in UGME because in Montreal our medical students were not, so they identified a gap in their surgical block. They were not exposed to trauma enough. So Montreal is a wide city for trauma, and so they needed to be exposed to more trauma cases, and so they decided to use this platform. Basically we had lots of IT knowledge surrounding this platform. That's why it was used. For our cases, we knew likely we would use scholarship around it, so we got IRB approval, and each case starts with a consent form and a pre-test and ends with a post-test. And then the cases are currently there's an illustrator trying to make them a little bit more authentic, but this is just to give you an idea of the types of questions. So there are multiple choice questions, there are free text questions, there are true or false questions, and basically they go about 25 to 30 screens or notes per case, and they take about 30 to 45 minutes to complete each. And there's automatic immediate feedback, so if the question is wrong, the right answer shows up. This is an example of a short answer or free text. So this is the answer that comes up immediately after they've entered the answer in the text box. And just to go through quickly the concepts that were dealt with is so things like epidemiology, anatomy, what to expect on taking pertinent positives and negatives from history. So this would be a free text type of question. Findings on physical examination, how to describe imaging, staging with links to references like the HACC, management questions. It also ends up being an important source for residents who are going to be on call, because we'll include the pertinent literature that they need to know surrounding these types of problems. There's also some communication skills, as the residents will have to type in how they would summarize the case for their attending after the consultation. So radiation planning, they have to fill in a prescription with what they would write in a prescription, for example, for a simple treatment for spinal cord compression, for example. We also tried to include a little bit of concept of self-assessment. So what did they think were their main strengths, weaknesses with this case? What were the take-home messages from the case, etc. So we just did a small pilot with a pre-test and post-test on those cases with 9 of our residents. And we found that from pre-test to post-test, not surprisingly, the marks improved by 27%. Obviously, this doesn't test recall or anything. It was just right away, right after the question. So in terms of conclusions, we can use virtual patient cases for teaching the management of oncologic emergencies. You can use a simulation-based platform, and the preliminary results are promising, although we do have to retest learners to assess their knowledge retention. We are very much interested in the qualitative data on the user-friendliness, the satisfaction, and also the self-assessment piece, which is not analyzed yet. And we're going to integrate those modules in using a blended learning approach in the future. I'd like to thank Ziad Fawaz, who was the resident who did a lot of this work. And amazingly, he did that work in the context of a medical education elective at McGill in 1 month. He developed the content and etc. So that's a plug for our medical education elective. So since 30% of you in the room are trainees, I invite you to beautiful Montreal to do a med ed elective.